Hello, everybody. My name is Ellie Covarrubias. I am a white, cisgendered female. I use she and her pronouns. I Something that I hope to gain from this course is, this is one of my very first courses as a master's student. So I'm really just trying to get my feet wet in the material and just gain a clear understanding of the different laws and ethics that are currently in place for practicing MFTs and their clients. Additionally, I'd like to learn how to implement those laws and ethics in future practice as well. Three most interesting things about myself. So I have a dog. Her name is Layla, and she's 5 years old. She's a Shepherd Staffy mix. She's my best friend, and she goes everywhere with me if she can. I spend most of my leisure time walking her or hiking with her because she's a very active dog. She demands quite a bit of my attention in spare time, which I am very happy to give her. Another thing that is interesting about me is that I I love to cook, I love to clean, I like to be organized. I take pride in structuring all of my obligations and being organized and staying on top of my commitments that I make to myself and others. And something else that's interesting about me is I also am a certified substance use counselor. So I just recently took a position as a full-time clinician working in a residential recovery facility. So I'm getting my feet wet in the clinical world, and I'm also, like many of you, a full-time student as well. So yes, I've got my hands full, but I'm very happy to be here. As a practitioner, how will I determine what is ethical and what's unethical? So that's a great question. I think referring to the APA guidelines of ethics is going to be essential for practicing therapists. I also will make sure to keep up to date with the current codes and ethics and legislations put in place to protect therapists and clients. How I develop my guidelines for ethical practice, probably utilizing some of the laws that are already set in place for us, as well as holding myself personally accountable for maintaining multicultural competence and utilizing the best evidence-based practices that I can. Make a list of behaviors that you judge to. So some ethical behaviors, or I'm sorry, unethical behaviors for a therapist would include breaking confidentiality, not having unconditional regard for the client, unconditional positive regard for the client, or not adhering to, or not regarding diverse cultures and gaining a clear understanding of the different cultures and backgrounds that make people who they are. I think that's essential for developing an effective treatment plan, as well as building that therapeutic alliance that we all know is essential to the progression of the treatment. So yes, that's just a little bit about me. I'm looking forward to connecting with a lot of you, and I hope everybody has a wonderful semester.